India, as we know, we are faced with multiple health challenges. Malnutrition continues to persist. We also have a rising burden of non-communicable diseases, like diabetes, hypertension, cancer, mental health. We also have health risks due to environmental degradation and climate change. Different sections of the population, based on caste, class, gender, region, obviously they bear a disproportionate burden of health risks and outcomes due to these health challenges. So inequalities in health and healthcare continues to be a critical concern in India. The challenging public health scenario calls for a serious reimagination of public health education in the country. At the core of such an imagination, what it has or what we should have is basically how do we prepare our public health practitioners who are committed to the social purpose of public health, who have the required public health competencies, and most importantly that they are grounded in the field realities and contexts in India. It is towards this effort that we launch our Master of Public Health program. This is offered from our Bhopal campus. What the program offers, and I would like to highlight 3 features of the program. The first is that it is grounded in the values of equity, human rights and social justice. 2, it has a practice orientation with substantial field engagements in different parts of the country. And third is that it offers a competency-driven curriculum that consciously nurtures candidates, students' competencies to be able to work at the communities, programs and policy levels. Let me give 2 examples. At the community level, for example, they could identify the needs of a particular community, health needs of a particular community, and come up with a community health action plan. They will be able to measure the burden and disparities of a particular health problem. They will be able to actually design context relevant strategies for public health messages. They will be able to design a new intervention, using appropriate evidence and relevant intersectoral approaches. The program is aimed at a diverse audience, consciously inviting candidates from different disciplinary backgrounds, health sciences, social sciences, natural sciences, and from different sectoral backgrounds, with at least 2 years of work and field experience.
Azim Premji University has kept India's public health reality at the center of its Master of Health program. The program is led by its prime objective of creating public health leaders who are grounded in practice for strengthening a people-oriented public health system in India. To be able to do so, the MPH program provides ample scope and thoughtfully crafted spaces for field practice and hands-on learning. 30 of the 69 credits in the program are dedicated for the learning from the field and skill building. This is also meant to facilitate an active connect between theory and practice in their learning journey. The field learning engagements run through each semester and between semesters. Field learning is incremental, progresses with different complexities of skills in different semesters. In semester 1, students learn how to assess community health needs, understand social determinants of health, wherein semester 2, they immerse in programs and health systems. We have an exclusive field learning component of primary healthcare interventions, where students would be placed in organizations that have had long-standing engagement with primary healthcare. In semester 4, students spend 4 months, the entire semester, in an organization to pick up skills on organizational practice and systematically pursuing an independent project. These components are structured in such a way that students are able to draw inspiration from India's public health leaders, sharpen their perspectives, relate the theoretical knowledge to the field realities, and acquire adequate skills to engage with field realities. Beginning with this, the program at Azim Premji University hopes to see the students growing as leaders in the field of public health to improve and strengthen India's public health.
Apart from focusing on the content of the curriculum, we also invest in developing the learning processes. And this is to ensure that learning does not remain restricted to the physical space of the classroom, but we are able to build a community of learners. The MPH program at Azim Premji University is designed to ensure a synergy of theoretical perspectives with diverse empirical realities. Besides having the sound theoretical understanding, graduates will also be able to manage and implement programs well. In order to achieve this, we use different kinds of pedagogical tools and approaches which promote active and collaborative learning. So students will get ample opportunities to learn from public health practitioners. There will be one-on-one academic mentoring when students are doing their field project, internship. And beyond learning from textbooks and journals, we use case stories, worksheets, films. We also offer thematic labs, workshop on health communication, and we also use simulation games such as Power Walk. So the experience of learning at Azim Premji University is imagined in such a way that students are able to realize their own potential and are able to acquire competencies to achieve the common goal of health for all.
What are the career opportunities for someone who has graduated from our program of Master in Public Health? We imagine our graduates to be able to work in a range of setups: government technical institutes, non-governmental organizations, policy think tanks, in a range of roles, program managers, program leads, intervention specialists, communication and advocacy officers, and many more. Let's also remember that public health is not just a career, it's an urgent calling.